Hello, hello, hello. It's Thursday. It's Thursday, Whitman-Walker Thursdays. You know what I do on Thursdays. We talk with Whitman-Walker about topics. So today we're going to be talking about cancer, global impact, and local services that we do. So come on in, don't be shy. Come on in, come on in, come on in. Hello, hello, how you doing? Come on in, everybody. Thank you, love. Thank you for sending the live out. We're talking about cancer, global impact, and local services here in the DMV. So for anyone looking for that information, tune in. We're going to be talking about global impact with cancer and also local services here in the DMV. So if you're interested or know somebody that might need information, please come in. We're going to be talking about cancer today. So just waiting for my guest, Brendan, to come in. He's just coming in. Hello, how are you?
Hey, good to see you, Orlando. What's up?
Happy Thursday. I know, right?
Happy Thursday.
So yeah, we're here today with Whitman-Walker talking about our live cancer global impact. Are you talking with me today? Am I going to get to see you this time?
I am trying to turn around the screen and it's not letting me.
Oh, I was going to say, let's have a conversation, Brendan.
I know, Orlando. I'm trying to get back on with you. I might leave for 1 second, then try to come back on, okay?
Not worries. Not a worry. So yeah, guys, we're just trying to have Whitman-Walker on here so we get the viewers for them and for me. So for those of you newbies, I'm a social media influencer here with the Whitman-Walker Health Clinic. So we usually talk about, pandemic things or just pretty much testing what things we offer with Whitman-Walker. So come on in. Today we're talking specifically about cancer, global impact, and just information on cancer and mostly the local services we have here in the DMV. So we're going to get started. Like I mentioned earlier, we are talking about cancer awareness. For those of you that didn't know, February 4th is Cancer Day, World Cancer Day. Aims to raise awareness, improve education, and advocate for greater actions around cancer prevention and treatment. Cancer is the second leading cause of death globally, accounting for 1 in 6 deaths every year. Approximately 70% of deaths from cancer occur in low and middle income countries. And that's largely because late-stage presentation and inaccessible diagnosis and treatments are far from too common there. So if you guys have any questions, feel free to ask. Ask any questions. I'll be going back and forth from my information I'm reading off to you guys, and also trying to see if there's anything I can't answer. I'm going to make sure and get back to you, and I'll ask somebody who has more information. So don't be shy. Comment with me. Tell me you're doing good, ready for the weekend. I appreciate you guys joining me today. All right. So more than 90% of high-income countries reported having generally available treatment services. Fewer than 30 of low-income countries could say the same. Cancer doesn't have to cause so many deaths. Many cases are preventable. 1 in 3 cancer deaths results from dietary and behavioral risk factors, including high body mass index, low fruit and vegetable intake, lack of physical activity, alcohol use, and tobacco use. So tobacco is the most significant of the risk factors, accounting for about 22% of cancer deaths. Certain infections like hepatitis, HPV, which is the human papillomavirus, also cause a number of deaths. Since we know many of the risk factors for cancer, we should do everything in our power to prevent it, which include abstaining from alcohol and tobacco, staying physically active, eating fruit and veggies, practice safe sex, not sharing needles, limiting sun exposure, and wearing sunscreen, and of course getting vaccinated for certain cancer-causing viral infections. In addition to prevention-based lifestyle changes, Regular self-exams and screenings can increase your chance to detecting cancer early. When a treatment is most likely to be successful by finding out early, of course. So things you can ask your doctor if you should screen for: cervical cancer with a pap smear, breast cancer with a mammogram, colorectal cancer with a stool test or colonoscopy, lung cancer with a low-dose CT scan. You can also perform self-exams for early detection. Let me make sure nobody's asked any questions. Hopefully everybody's doing good. For those of you who came in late, we're talking today about cancer. Don't forget that February 4th was World Cancer Day. So for those of you who didn't know, that's why we did a special today on cancer and information with global impact and local services we have here in the DMV. So come on in. If you're just joining, we will save this later into our page. That way you'll be able to see it if you missed part of it. All right, so we talked about things you can ask your doctor to screen for. Now we're going to talk about performing self-exams for early detection. And that would be for cancer, for those of you who just joined. That would be for testicular cancer, feeling for lumps. Also for breast cancer, feeling for lumps. With skin cancer, you want to look for new or changing moles, blemishes, or freckles. On January 22nd, the day after inauguration, our First Lady of the United States, Dr. Jill Biden, visited Whitman-Walker Health to underscore the importance of cancer screening and personalized patient navigation, especially during this COVID-19 pandemic. In the summer of 2020, rates of cancer screenings were around 35% lower than pre-COVID levels and have not increased very much since. So I think either people are just afraid to come out or scared to, go ask for help or go get tested or be able to, talk about it, or just don't know because they're not really aware of what they're looking for. And some people just have lack of information. So that's why we're trying the social media to get people a little more informed about what to do, how to do, and what are ways that Whitman-Walker are here helping. With that being said, this year's theme is I Am and I Will, emphasizing how our individual actions, big and small, can make a lasting impact. So let's ask ourselves, how will we commit to fighting cancer? Get screened by your doctor, go to your healthcare provider, Whitman-Walker, perform your self-exams, check for testicular, check for breast, check for lumps, check your skin for any cancer, skin cancer. Make a social media post. Just post. Go to Whitman-Walker. We have posts about cancer. So make sure you just share that little post. That way people who really aren't aware of where to go or who to ask can see that you posted it and they might be interested in looking up this information. Spread information to your friends and family. Not many people are on social media. So if you know your parents are a little older, or your cousins, or your uncles, any family, friends, let them know, hey, have you gotten tested? Have you gotten screened for cancer? Ask your political reps to take action. So that's very important. Make sure that they are doing important things in order to help people. Just be aware, be informed. We don't want to find out about cancer way too late. We want to find out about it early and see if we can kick it in the butt. So we know it can be difficult to navigate cancer prevention and treatment. So Whitman-Walker is definitely here to help the process easier for you. So let's see. Just checking if we have any questions. Thank you everybody for joining. We appreciate all the love. Thank you guys for all the hellos. So if anyone, we're going to put the information down here. And again, you can find this later in the Whitman-Walker page, as well as my page. So if you have any questions, cancer-related services, including screening, support groups, and education, email RKEITA, that's RKEITA, at Whitman-Walker.org. RKEITA at WHITMAN-WALKER.org. And she can get you any information with what Whitman-Walker does for screening and any information that we can help with. We're more than here to help, all right? Okay, if anyone, so if you have, go ahead and DM the Whitman-Walker here, okay, and we can see what we can do for you, Max. All right, all right. So let's see, and prevent cancer by getting screened, performing self-exams. Self-exams, spread CDC facts about cancer. So with that, thank you for tuning in. We are here just to share information today. We did pick cancer impact on global impact and services with local DMV area. So don't forget, Women Walker is open for screening. Also, HIV, STI testing by appointment at our Liz location in Northwest DC and our MRC location in Southeast DC. To make the appointment, you can call 202-797-4439. Social distancing is always a way to reduce the amount of COVID, the pandemic we're going through now. So make sure you don't forget that a pandemic is going on. It deliberately increases the physical space between people to avoid spreading the illness, especially around holidays where many people like traveling or want to see your family. So make sure you don't forget the rules. Stay at least 6 feet away from other people when possible. Wearing a mask in public, avoiding places with a large crowd, encouraging work from home if possible, speaking with loved ones over the phone, over FaceTime instead of in person, social distancing as caring for your community, stay up to date on local, state, and national guidelines for testing, quarantine with general safety, washing your hands for at least 20 seconds at a time, staying home if you don't feel well. And don't forget, follow Whitman-Walker, and they will be able to get you guys more information if we didn't touch a topic that you wanted to ask us about. Feel free to follow us on Twitter, Facebook, or Instagram at Whitman-Walker or at RealTalkDC_ to keep updated with anything related to Whitman-Walker. And again, we'll have this video on my page and also Whitman-Walker page. So if you missed anything today related to cancer, global impact, or just local services, things we help here with the Whitman-Walker. So thank you guys so much, so much, so much for joining today. This was my Thursday. This is my Thursday of Whitman-Walker Live. So make sure to join me. And we are here for you guys. If you have any questions, hit us up. Thank you so much, Brendan. You guys have a great day. Be safe. Have a great weekend. We'll see you all soon.